What is Asperger Syndrome? Part 1. What does syndrome mean? The term syndrome is derived from Greek and means concurrence of symptoms. In other words, it means a group of symptoms that when put together are characteristic of a specific disorder or disease. It is called a syndrome whether or not there is a single cause, multiple causes, or, as is the case with Asperger syndrome, the cause is unknown. What does Asperger mean? Many syndromes are named after the person who first connected the various symptoms. Asperger syndrome is named after the Austrian paediatrician and psychiatrist Hans Asperger, who was born in 1906 and died in 1980. A brief history of Asperger syndrome. In 1944, Hans Asperger published a paper after studying 4 children who, despite their intelligence appearing normal, showed difficulty in integrating themselves socially, lacked non-verbal communication skills, demonstrated limited empathy, and who were physically clumsy. Their speaking was either disjointed or overly formal, and their interest in a single topic dominated their conversations. Asperger called the condition autistic psychopathy and described it as primarily marked by social isolation. Asperger called his young patients little professors and believed some would be capable of exceptional achievement and original thought later in life. Asperger's paper was published in German during the Second World War and so was not widely read elsewhere. During his lifetime, Asperger's work remained largely unknown outside the German-speaking world. The first author to use the term Asperger syndrome in the English language literature was German physician Gerhard Bosch, who, in 1962, published a paper detailing 5 case histories of individuals with pervasive developmental disorders. 8 years later, the paper was translated into English, becoming one of the first to establish German research on autism and attracting attention from outside the German-speaking world. The term Asperger syndrome was later popularized in the English-speaking medical community by Lorna Wing in her 1981 publication of a series of case studies of children showing similar symptoms. She chose Asperger's syndrome as a neutral term to avoid any misunderstanding that could arise by the term autistic psychopathy, distinguishing it from psychopathic and sociopathic behavior. Wing's publication effectively introduced the diagnostic concept into American psychiatry and renamed the condition as Asperger's. However, because she included some mildly retarded children in her case studies, her work blurred some of the distinctions between Asperger's autistic psychopathy and classic or Canarian autism. The first systematic studies began to appear in the late 1980s in publications from Sweden, the UK and North America. Asperger's work became more widely available in English when Jutta Frith, an early researcher of Canarian autism, translated Asperger's original paper in 1991. Asperger's syndrome became a distinct diagnosis in 1992, when it was included in the ICD-10, the 10th published edition of the World Health Organization's Diagnostic Manual, International Classification of Diseases. In 1994, it was added to the DSM-4, the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders, under the name Asperger's Disorder. There is little consensus among clinical researchers about whether the condition's name should end in syndrome or disorder. 2 decades after the widespread introduction of Asperger syndrome to the English-speaking community, hundreds of books, articles and websites have attempted to describe it. In that time, reported cases of Asperger syndrome have increased dramatically. However, questions remain concerning many aspects of Asperger syndrome. Whether it should be a separate condition from autism is a fundamental issue requiring further study. The diagnostic validity and use of the term Asperger syndrome is uncertain, and there are questions about the empirical validation of the DSM and ICD criteria. It is likely that the definition of the condition will change as new studies emerge. One of the proposed changes concerns the DSM-5, set to be released in May 2013. If the change is accepted, it will eliminate Asperger syndrome as a separate diagnosis and include it under the umbrella term of autistic spectrum disorders. Under the proposed changes, autistic spectrum disorders will be rated on a scale ranging from severe through moderate to mild, based on clinical demonstration.